And lastly, I want to discuss the trials of dual immune checkpoint blockade in combination with chemotherapy or by itself. The first trial to discuss is a Checkmate 227 trial, where the combination of nivolumab and ipilimumab. So ipilimumab is another type of immunotherapy which targets different pathway of immune system called CTLA-4 molecule, and this was compared mainly with chemotherapy. And in this trial, and now there was a 5-year overall survival update recently published, and in the subset of patients with PD-L1 expression at least 1%, there was continued benefit favoring nivolumab plus ipilimumab compared with the chemotherapy, and confirming the benefit that we saw in earlier result analysis. And the benefit was seen in both non-squamous histology and then squamous histology, as seen on the right. While the approval of the nivolumab ipilimumab was given to those with the PD-L1 at least 1%, the outcome in PD-L1 less than 1% was also interesting in the sense that the hazard ratio, which is a measure of the survival benefit, was pretty good, even in those PD-L1 less than 1%. So in the overall study population, nivo plus ipilimumab as compared with the chemotherapy has shown better survival benefit with hazard ratio of 0.65. And then one of the interesting subgroup here was the squamous cell histology group, where the nivo EP really beat chemotherapy alone pretty well, with hazard ratio being low at 0.52. And this is a subgroup of patient where I think about using this regimen sort of off-label, though I have to admit that this regimen is approved by FDA for PD-L1 at least 1%. And one of the interesting features of the combination dual immunotherapies, nivolumab ipilimumab, is that the duration of response is pretty good. If you look at the numbers, ranging from 18 months to 31 months, if you respond to the treatment. And this is one of the important features of dual immune blockade, in my opinion. So the team asked this question: can we use the nivolumab plus ipilimumab in combination with chemotherapy? And here they gave only limited cycles of chemotherapy, only 2 cycles of chemotherapy, and combined with nivolumab ipilimumab. And this is trials called Checkmate 9LA trial. And when you look at the overall survival, and this is recent update, the quadruplet combination nivo plus EP plus chemotherapy was superior to chemotherapy alone, as this is a theme that we have seen in other trials. So not very surprising, but then again, confirming the benefit of adding immunotherapy to chemotherapy. And then the hazard ratio was 0.74, leading to FDA approval. And then the benefit is seen across different PD-L1 levels. And lastly, and this is the newest kid on the block, Poseidon trial, where the combination of durvalumab, which is PD-L1 inhibitor, was combined with the tremelimumab, which is anti-CTLA-4 inhibitor, and a chemotherapy. And so this is, again, 4-drug regimen versus chemotherapy. And on the right, it's the survivor curves for the quadruplet therapy, durvalumab plus tremelimumab and chemotherapy versus chemotherapy alone, with favoring the quadruplet combination with hazard ratio of 0.77, 23% reduction in the risk of death when patient received the 4-drug regimen versus chemotherapy. And this has led to the approval by the FDA very lately in November 2022. To summarize all the trials that I discussed from the beginning, Keynote to 024 trial to Poseidon, what the trials have shown was that there was significant benefit in terms of overall survival, in terms of how long people lived. And all trials showed overall survival improvement when patient received immunotherapy-based regimen versus just chemotherapy, which was our old standard of care.